Hi, my name's Jemima. I'm a physio, and today I'm going to be talking about knee pain, specifically patellofemoral pain, which is located at the front of the knee. The main symptoms you might experience when you're suffering with patellofemoral pain are things like going up and down the stairs, kneeling on your knees, squatting, and also sitting down for a long time and trying to get up. Now, the main things that cause these kind of pains is muscle imbalance. What we mainly see in the clinic is those who suffer with really weak outside muscles and inside muscles of the thighs, but really strong quad muscles. Now, if you imagine you've got 3 ropes sitting around the kneecap. You've got your main muscle, which is the quad muscle, but you've also got muscles on the side called the abductor muscles, or muscles on the inside called adductor muscles. What tends to happen is we overuse our quad muscles, but our abductor muscles and adductor muscles don't work as well together. Because of this muscle imbalance, it causes the kneecap to slightly shift out of the little groove that it sits upon, and that causes knee pain with irritation and sometimes swelling. The main thing that we use to fix this is by making the muscles stronger on the outside and on the inside of the knee. So you find things like squatting, by making sure your kneecaps go over your knees, not go inwards or go outwards. Also, you might find things like lying on your side and lifting your leg up and down. So we're working on the abductor muscles to make them stronger. The stronger these muscles get, the more in line the kneecap will become once again, and that stops the irritation going on at the kneecap. So many people can suffer with patellofemoral pain. However, we mainly see females, and this is because of the acute angle, so the angle of the hip bone. Because of the angle of the hip bone, it puts slight pressure on other muscles that attach to the knee, causing the muscle imbalance as well. Now, again, other people that we do see with these kind of pains is those who do repetitive knee bending sports such as skiing, basketball, and running. This is because sometimes you tend to overuse your quad muscles, but you're not using your outside and your inside muscles as mentioned before. So this all comes down to muscle imbalance. However, as we mentioned before, it's not just females that get it, it is athletes. Not only athletes who get it, but also people who have flat feet. Now, if you look at the angles of your feet, if your feet face inwards if your feet roll inwards, it causes their inside muscles that are attached to the ankle to work harder, but not as much on the outside muscles. This then travels up to the knee as well, because you've got a really big muscle at the back of the knee called the gastrocnemius muscle. This works over the knee muscle and also works over the ankle muscle. If you've got very flat feet, the gastrocnemius isn't working as it should be, and it comes to attach to the knee, so it can affect the knee, and this can cause the anterior knee pain. Again, so with these type of people, we tend to do a lot of stretching and a lot of strengthening of the gastrocnemius, and also insoles as well can sometimes help just correct the alignment of the feet and can take the pressure of the gastrocnemius to stop overworking, which can in turn then turn around and help with your knee pain as well. Another reason why you might get anterior knee pain that doesn't come directly from the knee is because of the hamstring muscles. So this comes with those who are hyperflexible and tend to overextend their knee, which means you straighten your knee and your knee goes past that straight point and it turns inwards like this. Tight hamstrings play a role in your knee function. They help to bend and also straighten your knee. If these are very tight, then your knee doesn't move the way it should be, and that comes down to body mechanics. So again, it then turns around and plays a role in that muscle imbalance, but this time it's not happening at the front of the knee, it's happening at the back of the knee. So with people like this, we then tend to do a lot of bridging with them, a lot of stretching of the hamstrings to help stretch out the hamstrings, causing pressure off of the knee. So, how do we test those with patellofemoral pain? Normally, you go to your GP and sometimes you get referred to physio. When you come to physiotherapy, we test things like your quadricep muscle strength and also your outside muscle strength, which we call the abductor. We should probably use the correct scientific name for it. It's called the abductor muscles, aka your glute muscles. So we test the strength of these. Normally, when you've got weak muscles on the outside, you normally tend to have weak muscles on the inside as well. We then look at how you do your squat. If your kneecaps come inwards or outwards, we call this valgus and varus. We also look at the length of your gastrocnemius and also the length of your hamstrings. Tight hamstrings give indication, as we mentioned before, same with tight gastrocnemius. We also look at your feet placements to see whether you've got flat foot, and that's the reason why you are getting your knee pain. Knee pain doesn't always have to come directly from the knee. Sometimes it starts at the ankle, or sometimes it starts at the hip and it gets referred down to the knee just because of how the body's moving. If you imagine you've got a sprained ankle on your left side, your right side is probably going to have to work much harder, because moving your left side is painful. This is what happens when you have your knee pain. Something's not working correctly, so the other muscles take over and they start to compensate. Overcompensation can cause tightness. Overcompensation can cause weakness as well, because this means that something's working too hard and the other's not working hard enough. As we know, muscles tend to work in pairs. Your front muscles will work with your back muscles. Your inside muscles will work with your outside muscles. Now, if your inside muscles are very, very painful, your outside muscles have to take over and work extra hard. But if your outside muscles are working extra hard, that means that it's going to cause pain. This is just an example, but this is basically what happens around the knee that causes the muscle imbalance. And this is why we sometimes get referred pain from the ankle and from the hip. Because the hip joint isn't working properly, the knee joint has to take over. Because the knee joint isn't working properly, that means the ankle now has to take over, and it means that because of your body mechanics, your overall gait may be changed in the way you're walking. You don't realize it because it's just how you're walking just in general. Again, those who come in with flat feet don't realize that the flat feet is causing a problem up into your hips or up into your knees, but it all starts from somewhere. Now, with those that suffer with anterior knee pain, as I mentioned before earlier on, we do go down the strengthening route. However, we can do other things to help limit the pain. The first thing is obviously try and get rid of the pain. This can be done by icing, because you might notice there might be swelling around the knee. That's completely normal. That's your body's normal reaction to something irritating. Another acute thing that we might do to help manage the pain is taping. So I use this a lot with my athletes. So we tape around the knee, and that just helps encourage the outside muscles to work as well as the inside muscles. It also helps to put the kneecap back into place, even though it hasn't necessarily moved. It's simply down to the muscles and where the muscles are attached, because something is working too hard. By doing so, you put the kneecap back into the groove, which can help stop the irritating that's going on and cause that inflammation and also that pain. You might feel clicking or creaking inside the knee. That again is completely normal. That does not mean that there's damage in your knee. Your body naturally clicks in places. This is sometimes because of the body's around the joints you have fluids, and the fluids have air bubbles. Sometimes that clicking is the noise of the air bubbles popping like a bubble wrap. The creaking that you're hearing, creaking as per se, is that kneecap that we talked about not sitting in the groove that it's meant to, and actually now rubbing on the bone, which can cause that irritation. Again, by using the taping, it kind of aligns the kneecap back into where it's meant to be. We call this maltracking, when the kneecap isn't sitting nicely in the groove and it's actually twisted a little bit to the side, or moves shifted a little bit to the side, whether it's to your left inside or to your right outside. As I mentioned before, those with flat feet, we tend to fix it by putting in insoles. By putting in insoles, you then realign and put your body back into normal alignment, which makes it easier for the muscles to work as it should do. Again, this is if the problem is coming from the feet. If the problem is coming from the muscle imbalance, as we mentioned before, we go along the strengthening route. So I give a lot of my clients squats, because squats tend to be your best friend, but against the wall. I also do a lot of single leg work, because this is where your glutes play their role in terms of stability. So your glutes are on the outside, and on the inside you've got your adductors. If you stand on one leg, your glutes need to be able to work properly with your adductor muscles to help stabilize the leg, to stop you falling over. Now, people don't realize how important single leg stance is, but it's very important because we use it in our everyday life. When you're walking, you go from one foot to another foot. In that small space where you're transferring feet, you need to be able to stand on one leg. So overall, in terms of anterior knee pain, if you feel creaking in your knees, or if you feel your knee clicking, that is nothing to be worried about. There's no internal damage going on. Most likely it's either coming from flat foot, which can be fixed with insoles, or it's coming from muscle imbalance, which can also obviously be fixed with strengthening exercise and a lot of strengthening exercises. If you're an athlete, I definitely recommend looking into taping, and also sometimes knee support and icing after every activity you do to bring down the swelling and by elevating the knee. Knee pain, anterior knee pain, is very, very common in this country and all around the world. It is very fixable, and it's not something to worry about. If you've got any other questions, then feel free to ask me. Thank you.